Today's guest speaker is Dr. Daniel Zinnel, the CEO of Proteus. Proteus is a multi-state nonprofit that has been serving agricultural workers and their families since 1979. It serves workers and their families who are experiencing lower socioeconomic statuses and need access to more resources, such as healthcare. Daniel has his PhD in education from Creighton, as well as an MA in health studies from the University of Alabama, BA. in liberal arts with Psychology and Sociology Minors from Grandview University, and A. from Iowa Central Community College. He has over 15 years of nonprofit administration and leadership, to include having served as the executive director of One Iowa. In 2024, he was a recipient of the LGBTQ Legacy Leader Award and many other awards in years previous. Please welcome Daniel Zinnel to the podium.
It's been a long week. I've been traveling, and so you are very lucky that this is the only group that I probably would wake up this early and come and speak to on a Friday morning. I've been in Indiana all week, and the last stop was my favorite stop. We visited an organic farm in Bloomington, Indiana, outside of where IU is. And it was owned by a gay couple. This gentleman was from Columbia, and he met his husband. He came to IU to study music, met his husband, who is from Kokomo, Indiana, and they've built this life together in this incredible farm. They do have 2 Airbnb places where you can stay, and so if you're interested in that, let me know. But they hire refugees. So they have an individual from Syria right now, and then one of our participants is also working there. He's a refugee from the Congo in Africa. And so thought it was a great way to kind of transition from my day-to-day job to coming and talking to you. It's great to see so many familiar faces. It's been a while since we've seen many of you. Pandemic kind of throws a wrench in all of that, and so it's great to be here. You might be wondering, why Proteus? I am a lifelong Iowan who grew up on a farm outside of a tiny town called Pomeroy, where Mr. Brad Holland is also from. His sister was my French teacher. A lot of connections. Yeah, I grew up on a farm, so I did all the things that any farm kid would do: baled hay, walked beans. I worked for not only my parents, but other farmers in the area. I worked on a sod farm. I did baling for other farmers. I sheared a lot of sheep for a lot of people, and so that's me shearing sheep when I had some hair. But a great childhood. I grew up in the late 80s, early 90s, and so the farm crisis definitely impacted my family. And without going to WIC clinics and accessing public assistance like food stamps, I truly don't think I would be in this position today. And so that really is why I do what I do. It's providing the opportunity to individuals who just need that lift up in order to provide for themselves and their families, and create that opportunity to develop generational wealth, create self-sufficiency for themselves and their families. So that's my why. All right, so who we are. Proteus is celebrating its 45th anniversary this year. We were started by Proteus of California, which is still in existence. At the time, the federal government asked some of the early adopters of farm worker programs to get programming off the ground in other states. And so Proteus of California came to Iowa to get what we still operate today. It's now called the National Farm Worker Jobs Program. It's a program offered in every state across the country. I'll talk a little bit more about that. But then in 1983, we broke off and became our own separate nonprofit here in Iowa. But our mission is to provide education assistance, job training, and healthcare access to farm workers all across Iowa, Nebraska, and Indiana. Our vision is very simple: a better life for farm workers. Very simple at that. And then we do have 5 values that we try to implement every day: compassion, integrity, empowerment, respect, and communication. You're probably wondering, Proteus, is that a pharmaceutical company? That's what we get a lot. Or many other variations, but Proteus is actually a Greek god, and if you prayed to him, he would transform into whatever you were in need of. And so that's the ethos that we try to embody every day: transforming to meet the needs of farm workers. Farm workers' needs are evolving all the time, and it's up to us to be nimble and adaptive in order to provide the best services they need. So we're not just in Iowa anymore. In 2011, we expanded into Nebraska, providing the services that I talked about earlier, the National Farm Worker Jobs Program. In 2013, we expanded into Indiana. In 1991, we did expand our services to also include healthcare, which I'll talk about in a little bit. But that's the history of Proteus. And all of the photos that you see, these are real live farm workers that we interact with throughout the year. And so it's not just stock photos. These are truly farm workers that we provide services to in Iowa, Nebraska, or Indiana. All right, you're probably also wondering how many farm workers are in Iowa. There's a lot. And there's varying definitions of what it means to be a farm worker. The broadest definition says that there are almost 112,000 farm workers or individuals who are dependents. That would also include people like my dad and my brother who are farming still today, but then also potentially there's some folks that would count meat processing workers in that number. There's over 2,160 farms. That number is continuing to decrease as we see the change in corporatizing agriculture across the country. And then in Iowa in 2022, we had the most ever H-2A visa workers come and work in our state. These are individuals who are coming from outside of the country. An employer has to do their due diligence and try and hire local folks, so the more domestic folks. If they can demonstrate that they cannot find local workers, then they can reach out to the state, which then reaches out to the federal government. It's a federal program that is implemented by each state. But you can apply for a certain number of spots of farm workers to come and work for you for a temporary period. Some are here for 11 months, some are here for 6 weeks. And it really depends on what the work the employer is wanting to get done. A lot of them come here to detassel, but we see other varying jobs that they might do, working on a hog farm, working in cattle. But I would say a good number of them are doing detasseling work. Most of them come from Mexico. There's a large number that come from other countries within Central and South America, but we're seeing others start coming from Haiti and South Africa. And so these are individuals who the employer is required to transport them here. They're required to house them while they're here, feed them while they're here, and then transport them back. And there's a federal negotiated rate for every state. I believe most is typically around $18 an hour, so really not a bad wage, especially for individuals coming from countries where that is a huge amount of money. And so a lot of individuals do this year after year, where they leave their families for months on end, thousands of miles away. And I describe it as almost like a prison setting, because they are confined to where they're living. They don't have their own car. They are really dependent on their employer to get them around in their community. And so they truly do find their community with the other workers. And it's truly amazing to see the joy that they create at migrant camps. We do have 2 large migrant camps here in Iowa. One is outside of Williamsburg. They turned a nursing home into some apartment living for migrant families. These are more domestic farm workers from the Valley in southern Texas, where it's more familial. So they bring families and it's more intergenerational. And so we have a lot of individuals who are working in their 70s, 60s, but then you have their kids and grandkids who are also traveling with them there as well. On a given year, depends, but I would say around 400 to 500 workers are at this particular site. And then at a location in Conesville, Iowa, outside of Muscatine, there's a large migrant camp where they bring all H-2A visa workers, around 600 to 800 individuals, all men. At some point in the future, I would love to do some research on the behaviors of these individuals, because I imagine there are similar types of behaviors as what we see in other settings when it's all men with a very limited access to other resources or being able to travel around. And so that's definitely an interest of mine. This just shows kind of the population of farm workers by county. And so the darker the color, the more farm workers there are. And then this is H-2A visa workers. So that dark blue is the Conesville location that I was describing as well. So farm workers work oftentimes 7 days a week, sunrise to sunset, don't have the benefits that many of us do within our jobs where they have PTO, they have health insurance. And so many of them don't take time off from work to access healthcare, to do the things that they need to do in order to take care of themselves. They work through illness and are here without knowing what the resources are in their communities. And so that's why Proteus plays such a critical role in connecting them to the services that they need, in addition to the ones we provide, but also other things like legal aid or workforce development services, or we have a state monitor advocate that is monitoring the treatment of these workers. So we are able to connect them to those individuals. All right, so Proteus today, the National Farm Worker Jobs Program. This is a program that we provide services to lower income farm workers or anyone in their household. So if there's a farm worker who qualifies, but maybe they have a child who is 19 that's wanting to go to a trade school, we can provide services to them. Our services are incredible with this program. We provide tuition assistance, so we can pay for some tuition. But the thing that sets this program apart is we pay our participants to go to class. So we pay them a stipend to cover basic expenses that they need in order to continue going to school. They get $6 an hour for every hour they spend in class to offset those costs and incentivize going to class. We can help pay for things like books, tools, uniforms, anything that's needed for their programs. We really focus on community colleges or other trades type of programs. So any 2-year programs that are in targeted industries, such as agriculture, the trades, or healthcare, and anything under that. So it could be a 2-year program, it could be a certificate, a diploma, a CDL, an apprenticeship program. Those are all the things that we really focus on to help our participants get that leg up. And most of our participants come into the program making less than 100% of poverty, and on average, they exit making over $35,000 a year. So huge return on investment. This is funded through the United States Department of Labor, and we have bipartisan support because it's a return on investment. They are going to pay more taxes, right? Which is then going to funnel back into offering these types of programs in the future. This one we do across all 3 states, Iowa, Nebraska, and Indiana. Some graduates we've had. This bottom woman, she is a young mother of 10 and is going to law school now. So truly incredible to see the transformation these individuals can imagine for themselves. Most of them see their parents working so hard. And we know that individuals who work so hard oftentimes don't have the same opportunities as many of us. And so to see this young woman reimagine what her life could be and see that she could be a lawyer in the future is truly incredible. Across our 3 states, we also provide what I call life-saving education. Our health and safety training truly impacts farm workers. We train over 7,000 across the 3 states on topics such as heat stroke and heat stress prevention, pesticide exposure. During the pandemic, we did a lot on COVID-19 mitigation, but we still lose farm workers even today to heat stroke. Just a couple years ago in Indiana, we lost a 24-year-old to heat stroke. So we go out literally to the farms. You can see our teams in action where we literally are going out to the fields, providing them with some brief information that is going to protect them and themselves. What are the things to look out for ourselves, but also really being able to look out for each other in the fields, especially when the corn gets so tall. That's where we see the most deaths, because an individual might faint and passes out and we can't find them when the corn is so tall. So truly life-saving information. We're hoping to expand into other areas within our health and safety trainings. Climate change is real. It's going to continue to impact us. I think in Des Moines, we just saw that impact this week. But even from the fires in Canada and how it's impacting our air quality. Farm workers have no choice but to be outside most of the time, right? And so we're trying to work with the University of Iowa on some mitigation strategies that we can at least offer to farm workers when we're providing them health and safety trainings. But there's more to come on that. We'll be hopefully working with some other corporate partners in developing some ATV prevention strategies, and there's hog confinements that have these big manure pits, and they're very dangerous. And so we'll hopefully be figuring out some additional strategies around that. In our Des Moines office, which we are just right up the street next to Oak Ridge on Center, so not too far, is our headquarters. We do have a food pantry that individuals from across the community can access. They don't have to be farm workers. And then we also do some food rescue, especially on days where we have clinics, where we'll go and get fresh food that we can put in our refrigerator, some fresh produce, and all of our patients can take whatever food home that they want. But on average, we serve around 250 families out of our food pantry in Des Moines. Our agricultural health program, we have nurse practitioners on staff. We have 2 full-time, and then we have other PRN providers throughout the state. And our healthcare delivery model, I say, is the most unique model in the whole country out of any of the community health centers in the world. We are just like primary healthcare here in town, and our make and model, our funding is the same, but who we serve is different and how we serve is different. We do have 3 clinics, our Des Moines clinic, Fort Dodge, and Iowa City, where patients can access care, but most of our care is mobile. We take all of our prescriptions, our supplies, and literally go out to the fields again, sometimes on site where the farm workers are working. We'll set up temporary mobile clinics, or we'll partner with a church or a library, whoever will give us free space in order to set up temporary clinics. Our whole goal is to eliminate as many barriers to care as possible, knowing the challenges that farm workers have working sunrise to sunset, 7 days a week. And so oftentimes we're not setting up clinics until 7 p.m. and we're there until midnight. Sometimes we've stayed later, but we want to see as many of these individuals as possible. Most of them, this is the only healthcare they're going to see all year. And so we want to make sure it counts while we have them and providing them with the resources they need. In the summer, we also hire a number of bilingual college students who get this unique opportunity to work out in the field. It's almost like they are leaving the country because they're able to use Spanish out in the field and connect with individuals and learn so much. But truly an incredible program. We serve around 1,200 farm workers or so each year and providing them with access to primary care. What makes us also unique if our farm workers have additional care that's outside of our scope, so dental, vision, other specialty care, we can make those direct referrals, transport them there, provide interpretation at that visit, and then we also operate a voucher program, so we kind of are like a third-party payer where we can pay for all or part of that service through a voucher. So truly comprehensive and holistic in how we approach our healthcare delivery. These are just some of the pictures of the team in action. This photo is one at the Conesville migrant camp. So this is our model: eliminate as many barriers to care, meet them where they're at, respond to their needs. So we bring over-the-counter prescriptions, we can write prescriptions, keeping farm workers safe. It's important for us to continue to show up. We've built trust within the farm worker community because we've been around for so long, right? And so we try to continue to build that word of mouth so that farm workers feel safe coming and accessing services with us, and truly culturally responsive to their needs as much as we can. COVID-19 was definitely a challenge for us, as you probably can imagine. The silver lining, I would say, was unfortunately for meat processing workers, how disproportionately impacted they were by COVID early on. And that gave us some fire to try and figure out how we can mitigate strategies to protect farm workers as much as we could here in Iowa. And so we somehow got a meeting with the governor's office, And that turned into a daily call that we had with the governor's office, workforce development, Department of Health and Human Services, Department of Homeland Security, and the state hygienic lab. All summer we had a daily meeting talking about how we were going to test as many migrants upon arrival. Thankfully, we had some additional money to do that, but we knew we couldn't do it alone, and so that's where all these other partners got pulled in. We had some money to put farm workers up in hotels, so if they did test positive, we could put them up in a hotel. We checked on them every day. We provided them with 2 hot meals every day while they were taking care of themselves. And it was truly an effective model because we also worked with the employers to try to mitigate their communal living situations as well. So try and imagine a big warehouse, 2 stories. You walk in the middle, you look this way, you look that way, hundreds of bunk beds. So that's what we were dealing with in one of our settings. And so we worked with them to figure out other communal living settings, but then working with the hotels to really put up individuals. And so we tested, I believe, 3,000 plus farm workers that summer in 2020. 0 of them died, which then gives me a lot of feelings on why could that not have been done with meat processing workers, right? And so it truly is unfortunate how things transpired and how individuals don't get the same access to resources as many others, but truly proud of our team for all the incredible work we did in the summer of 2020. 2021 was really focused on vaccines, but now we've kind of transitioned back to general care as a whole. So this is what our team looked like at the time. We set up outside clinics up at our Center Street location. So looking at the future, we've expanded in a few areas. One is our field program, so Farm Worker Youth Leadership Development Program. It's something that is really focusing on empowering our young farm workers to help them develop the skills they need in order to advocate for themselves and their families. And so our whole goal is to equip them so that we can get out of the way, they can be the face, the voice to advocate for change for all farm workers across the country. And so we're in our 3rd cohort so far. It's going great. We're excited to expand it over the next few years. But right now it's a virtual 10-week program where any farm worker youth between 18 and 24 can participate, but we're going to be bringing that in person in the future as well. We have our PASO program, which is a really unique program for us. We're partnering with Capital City Fruits out of Norwalk, which is a grocery store, online grocery store. You can buy produce and they ship directly to your home. We got some initial money from Tito's Handmade Vodka, of all places, to launch this program, but we're providing 100 farm worker families in food deserts, but we're also really focusing on our patients who are experiencing diabetes and hypertension so that we can hopefully improve health outcomes as well. But they are getting fresh produce delivered to their doorstep for free for 6 months. And we're hoping to continue to expand that as well. I believe you have some sheets. So Blake Clyde, our development coordinator at Proteus, handed out. Thank you, Blake, for being here. Talking about our financial empowerment program. That's one that we're very close to officially launching. It's going to be some cohort-based instruction, some micro-learning opportunities. We're starting with a page where we're creating videos on financial types of topics. We don't call it financial literacy because these are individuals who probably know how to budget better than any of us in this room, right? They know what it takes to manage their household and what's most important to them on paying the rent or putting food on the table or figuring out how they're going to make ends meet for this month. It's a huge challenge, right? And oftentimes they just lack the access to additional resources, additional information. And so that's really the focus of this program, not teaching them how to budget, they know how to do that, but opening up the resources and opportunities so that they can create greater generational wealth for themselves and their families. We've also launched, shortly after the pandemic, a pilot program where we started offering our services to meat processing workers, knowing that our healthcare delivery model works and knowing how disproportionately impacted they are by things like COVID. And so we've been really excited to offer those services to a small number of meat and processing workers so far, but we're hoping to expand that in the future. Another thing that I don't have on here is, I think really cool, we have a self-monitoring blood pressure program where we have blood pressure cuffs that are Bluetooth. And so we train the farm workers on how to use them at home. They take them home. Every time they use it, it gets automatically synced with their electronic health records so that we can monitor their health. And if things continue to get worse, we bring them in so that we can offer some sort of intervention. But it's a really great way to continue to monitor farm workers. The challenge with migrants especially is they're leaving. They're going to Minnesota, Michigan, Florida, back home. And so offering the care after they leave Iowa is a challenge. Thankfully, there is a program called Migrant Clinicians Network, so we can connect them to MCN is what we call them, and they can connect them to other healthcare providers in areas where they're working. But there's only a few number of us migrant health type of programs that are really focusing on agricultural health needs. We do have some upcoming events. So if you're around Thursday, November 7th, it is our annual I'm Thankful for Farm Workers dinner. So just like today, it's always great to, I think, pay homage to farm workers whenever we eat food. And so I challenge all of us to really think about how our food got to us, and not just food, but coffee, our clothing, our fuel, our liquor, our beer, whatever, everything is touched by farm workers. And so I think all of us should really care about farm workers, which means you should care about Proteus because we are providing the services that truly impact farm workers. So we have a really incredible event in the fall, all about celebrating farm workers. We do 2 Farm Worker of the Year awards. It's always incredible hearing their stories. And if you are interested, there are YouTube videos of our past honorees, and I encourage you to watch them. We also do a really fun event in December called Presents from Proteus. And so we partner with Toys for Tots. We get Hy-Vee gift cards. And so families come in, we hand out the toys to the parents, like we take the parents off, get the toys, put them in the car. The kids can do activities, so crafts, there's cookies, but then they get to meet Santa, who talks in their language, looks like them, and it's always such a fun event. All right, so how can you make a difference within farm workers? So attend our events. We do organize a long sleeve shirt drive in March around Farm Work Awareness Week. We hand out long sleeve shirts every summer to farm workers. It's a great way to protect them from exposure to pesticides, but also sun exposure. And so if you have long sleeve shirts, especially the lighter color and breathable shirts, even some of the like button down shirts are great. They really like those. We also do around Hydration Day in June, a campaign to raise money to hand out hydro flasks to farm workers. Many of them have plastic water bottles. They work in extreme conditions. That water is hot within probably 15 minutes. And so we've been really working over the past couple of years to raise funds to hand out hydro flasks to as many farm workers as possible so that they can keep their water cool all day. Continue to learn where your food comes from, but also maybe just think about your food every time you eat it. And then connect us to either community partners, company partners, anyone that you think would benefit from learning about Proteus and the work that we do. Follow us on all the things. You want to donate, great. I'll maybe end with one story that's not farm worker related, and then I'll open it up for questions. I haven't been looking at the time, so I don't know how much time we're good. So my sister is the director of rehab in Humboldt, Iowa. Does anyone know where Humboldt is? Have you been there? Anyone from there? Well, she is an occupational therapist and has been at this hospital for a very long time. And she reached out to me maybe 2 summers ago and said, hey, we have this woman, we're providing care in our hospice program. Her family And so she has many kids, and so her family asked her to write down a bucket list of her top 5 things she wanted to do. And on the list was attending a drag show, which is beautiful, right? She had never attended a drag show. She's always wanted to. And so my sister worked with her team and said, hey, I think my brother knows some drag queens. So she called me, and this is, it was magical in how quickly it all happened. So, I mean, this woman is in hospice, and they're kind of urgent on making sure that these things happen that are on her bucket list. And so my sister reaches out to me. She's like, can they come tomorrow? I'll see what I can do. So I reached out to Tyona and Vanna, and I think one of them had to work, but they moved their shift the next day so that they could travel up to Humboldt, Iowa, in order to provide this woman with something to check off her bucket list. So my sister said it was maybe the best thing that's ever happened to her hospital because it brought so many of her colleagues together. What started with this just like minimal drag show they turned their conference room into this ballroom. They decorated, they had a DJ, they had a set. And so Tyona and Vanna arrived. This woman wanted to kind of do a meet and greet with them in drag first before they performed. And so they did that. They each performed a couple numbers. They did some duets. And my sister said there was literally no one that was not crying in this room. Like and she had some sons who were people like who I grew up with in rural Iowa, like the types of men you would not typically expressing this type of emotion, right? But it was because they saw their mother, their loved one, get to experience one thing before she passed. They had a crown, so they like put a crown on her and interacted with her, and then they got out of drag and came back and were able to interact with her even more. And Tyona and Vanna said it has been the most impactful experience that they've had as a drag queen. But I tell this story for many reasons. One, just because you're one person, you can truly make a difference in people's lives. So I challenge all of us to vote. That's one thing that we all can do. That's just the one thing that we are marking off in a ballot box. But I also tell this story to challenge our assumptions and to challenge the stereotypes and the importance of humanity. And I think it just gave me a lot of hope for Iowa, a state that is quite scary right now. But if a place like Humboldt, Iowa can have a drag show, I think it can happen anywhere. And so I appreciate you all allowing me to talk about Proteus, but also share some personal connection to rural Iowa and hopefully inspire you to do something today and in the future that's going to make a difference in someone's life, whether it's a farm worker or maybe a loved one at home. What questions do y'all have? Yes.
So you said they make $18 an hour.
Those H2A workers do.
Okay. So is housing and food taken out of that $18, or is this
It's a question online, I remember. Question was, they make $18 an hour. H2A visa workers make $18 an hour. And the question was, do housing and food get taken off of that? For those individuals, no. That is all provided to them. So they're really making quite a bit of money because they're not having to pay for food or housing. There is a large number of farm workers who get taken advantage of. And unfortunately, we've seen some experience labor trafficking, which is not the sexy trafficking that gets talked about most of the time. That also happens, and it's something that is important to talk about as well. But I think oftentimes we overlook labor trafficking, which happens at a much higher rate within farm workers as a whole, where they're, and a lot of them get around it so companies might hire a crew leader who then hires their team. And so that's really how a large number of corporations get around hiring undocumented workers. And so these crew leaders, sometimes they have housing where they'll put them up, but they're not going to, some of them don't pay their farm workers till the end of summer. And then they'll take out the rent and they're left with pennies. And so that's where we see trafficking happen. Or farm workers will be told, I'll pay you by the acre, or I'll pay you by the pound. That's been kind of a historical way that farm workers have been paid in the past, some still today. I mean, I grew up on a farm. I couldn't tell you how big an acre was. Like, I mean, I could tell you kind of proximity, but not after completing an acres of work. And so there's definitely challenges, and farm workers vary based on their pay, but also status. Our health program, we don't ask the question, so we're serving anyone regardless of documentation status, health and safety the same. Our National Farm Worker Jobs Program, the individual accessing our services must be authorized to work in the United States. So that could be a DACA student, permanent resident, citizen, but unfortunately we don't serve undocumented individuals in that program. But if a farm worker who is undocumented does the farm work, they have a kid who's maybe DACA status, their kid could qualify under the parent. You didn't ask that, but I thought I would offer that additional information. Yeah.
All the services you provide, what is your major funding model to support all these activities?
So the United States Department of Labor for the National Farm Worker Jobs Program, Department of Health and Human Services for our health program, and then fundraising and foundations and corporate support. So when I started, it was quite scary because our funding was about 99% federal. It's quite scary. The whole goal is to diversify funding because you never know when those funding sources go away. Knock on wood, we've had our federal funds for decades. I'm knocking on wood because we are up for competition. I should be hearing any day now on those, but you never know. And so knock on wood, send all the good thoughts. But we've been able to decrease the federal reliance. And now I think we're closer to like 90% federal, which is still a lot, but we've grown from when I came 5 years ago, about 4.5 million, and now we're right around 7 million. Yeah.
What is your annual?
Oh, I see. There was a hand back there first.
I'll go ahead and the Youth Leadership Development
Yes.
Program. That's amazing.
Thank you.
If I were a big agriculture company with maybe not great labor practices, that would scare it and upset me. What is your relationship like with employers? And you have to at least have a good enough relationship, right? They don't interfere with what you're doing. How do you cultivate that?
Great question. It's nuanced, right? Because we don't want to ruin the relationship with the large employers, because then if that impacts our ability to come on sites, then the workers suffer. And so it's a very significant, delicate balance on how we navigate them. So we are not always the enforcers or the compliance of things. Obviously, if we see things, we refer to the people who do that type of job, or we will refer the farm workers to the individuals who can help them. And so that's typically how we navigate. I will say some of the larger companies are maybe the best in how they treat their employees because they're under such strict scrutiny. And so I think that's why it's so important to see some of the bills we're seeing introduced, like recently, where there's a bill that was introduced to protect farm workers on working in extreme conditions. We need things like that to happen. Otherwise, employers are not going to follow them, right? And so we need to really work on policy change so that it gets down to the ground of impacting farm workers. But I will say some of the corporate are the easiest to work with because they do have such strict scrutiny. It's harder with some of those crew leaders who have no one that's really regulating them, and it's a challenge. But we try to navigate as best as we can. Yes.
What is the organization's annual operating budget? How much for the whole year do you guys have?
Around 7 million. Not quite this. I think it's like 6.9 this year. Last year was the largest budget we've ever had. I think it was 7.2 million, but a good chunk of that was we received some USDA funding to pass down to farm workers and meat processing workers. So if you had done farm work or meat processing work during the pandemic, it was this delayed stimulus check, which is kind of ridiculous because these were the individuals who had to do all the hard work during the pandemic, but they got $600 per person. And so we're wrapping that program up this October. We've distributed over $4.5 million to the pockets of farm workers and meat processing workers over the last year and a half.
What are some of the challenges is the fact that there is very shameful office and then also about the youth program. What are some of the trainings?
Good question. Over the decades of work we've been doing, we've been able to really cultivate relationships with both the corporate employers, some of the farmers themselves, some of the crew leaders. And so we try to maintain those relationships. We do see quite a bit of turnover in the farm workers that come back, but there's still a good number that come back year over year. And so that's another great way for us to really get the word out through word of mouth, through the farm workers who are coming back year over year. And so we've served, I think, 4 different generations of farm workers in the 45 plus years, because a lot of those workers are coming back. They're bringing their family. I just interacted with H2A workers in Indiana, and we were talking with one gentleman who is kind of the team lead, and over time he's brought more and more of his brothers. So there were 4 brothers working at the same time in this community outside of Goshen, Indiana, where Janet and Mark Rosenberry live. Actually, I got to see them, for those of you who know them. So it's this, I would say, multidisciplinary type of approach where we're trying to reach at all levels. And then we also do some social media. We're able to communicate through WhatsApp because a lot of them don't have cell phone service here. And so they're able to communicate through WhatsApp. But I would say multi-level. As far as topics within the field program, it's really focused on helping them develop their own identity as a leader. And so we do a lot on authenticity and helping them develop the leadership strategies that are going to work for them. We do a lot on building confidence, on public speaking, on advocating. So each week there's a specific topic that we focus on throughout the 10-week program. And the whole goal is to help them by just improving their self-efficacy of speaking out on topics that are important to them. Yeah.
So your name, Proteus, is like
Yes.
or to God or whatever. What's that connection to your organization? How does it brand you? And then secondly, with the dumpster getting reelected, how does that impact our food security as the food chain is going to be potentially interrupted with the massive deportation of
Yeah, that's a challenge. I don't know, like, the origins of why they chose Proteus as the name, because it's Greek. You would think they would have used a Spanish word that means something, but I have never heard the full story of why they chose Proteus, but it is the ethos of transforming to meet the needs of farm workers. So that's kind of just the general reason why we call it Proteus, or why we called it Proteus. There's been times where I think boards in past have wanted to maybe rename, but I think it's here to stay. It's something that we're trying to build a brand around, awareness as well. As far as the threat of what could happen, I think it's challenging. I think it's really unfortunate that we use individuals that impact our kitchen table as a pawn to ignite fear. And I hope that we can get back to really talking about the humanity of the issues, because these are individuals that are probably the most hardworking people I've ever interacted with. They care so much about their families. They are sacrificing so much for their families. And to treat them so badly and horribly is atrocious. And so I'm hopeful that at some point we can get to a place where we do have some immigration reform. Probably not going to happen for a while, but there has been the introduction of an immigration bill that would it's not great, but it's at least a start that would allow farm workers to have a pathway towards citizenship, knowing that they historically have done so much for our country. And I often describe it as kind of postmodern slavery. We're experiencing with farm workers today and how they are treated out in the fields in many ways by our government in many ways. And so hopefully we can get to a place where there is some transformation within policy, but it is quite scary what could happen. And not only for the farm workers, but our society and our economy. So think about our agricultural economy. If we did not have farm workers, our agricultural economy would be horrific.
It seems then that part of our problem is that we need to educate people as far, when we think of the immigration.
Yeah.
So much of it is taking jobs away from us. Whereas, when we honestly look at the thing, farmers advertise for jobs and get absolutely no response from American workers, absolutely none. That's when they can go to these programs, and there are limits and ways that they have to go through to get those workers. Most of the American public are not aware of that, so we need to educate the American people about the issues of immigration, or we're never going to have to see any changes.
So true. So hopefully you all learned something where you can maybe demyth or debunk things that you're seeing on social media or within your family, that you can talk about things by using actual facts and try to inform people so that they are making better decisions on who they're voting for, how they're interacting in their community. Yes, Rick.
From my day point of view, I'm curious about if the program involves a lot of positivity, which I think it does, that when recruitment comes, are LGBT people noting that coming to America and getting these good jobs and so increase their numbers?
I'm not quite sure on that, but we do serve, obviously, a number of LGBTQ individuals. We ask the questions and we do a lot of training with our team. We did, it's not answering your question, but it made me think of something else that we do offer or has started offering. Before, we didn't do a lot of lab testing. And so 2 years ago, we started some STI and HIV testing for farm workers, which has been really incredible to see that grow astronomically. So that's been, I think, something I'm proud of that we've been able to do over the past couple of years. But we've historically always served LGBTQ farm workers, maybe not as high of rate as I would have thought, but I think there's still some stigma we see within communities, even farm worker communities, where it's a challenge to come out. And so hopefully we can continue to be there for all of our patients, all of our participants, and provide them with a safe space where they can be their true authentic selves and accessing those services.
One last question.
Hey.
You mentioned that they often get used financially. Is there a need for banking services, or would they trust banking services?
That's part of the financial empowerment program, because a lot of them don't trust. They come from countries where it's very disruptive in how their banking services are offered. And so a lot of them have grown up where you put your money under your mattress or in a can and you bury it. And so that has definitely been a challenge. And so we're trying to work with some of our financial institutions to bring them at least the information, and then it's up to them on how they want to navigate that. But we really try to focus on some of the more international banks, because a lot of them wire money home too, and they lose so much in fees. And so if we can help them make their money go a little bit further by talking with maybe an international bank that they can wire money without that huge fee, then hopefully it's going to make a difference in their lives. And so that definitely is a big piece to the financial empowerment program that we'll be offering.
I want to thank you
Oh,
very
thank
much
you.
for your message today, and literally food for thought
Okay.
in many ways,
Thank
pun
you.
intended.
Yes.
The impact, I just did not appreciate all that. So thank you very much for your work, and congratulations for all that you do for the community and the state.
Thank you.
And remind you, next month is the mayor is the speaker, so bring friends. And then the last challenge I have for everyone in the room, let's double the size next time. Find a friend or two, invite them, maybe even pay for their breakfast. Get them here to show them what this is, to get it sticky, to actually grow our membership, to help what our function is to help people that are dealing with their own sexuality as well as our outreach to the young youth of today, the leaders of tomorrow, through our scholarship program. So that's my challenge. Ask at least two. You may get zero response, but ask two. That's the hard part. It's like going on a date, you got to ask. And I'll see you next month.